Okay, today's topic is going to be on functional family therapy and how it is effective in treating teens and families in cases of abuse. My name is Katie Moore. This is for Fall 2014, Vulnerable Children and Families. This program was designed to provide an alternative solution to traditional methods for dealing with adolescents with maladaptive behaviors. Beforehand, it was believed that juvenile delinquency was due to negative influence from social groups. However, it is now accepted that the root cause of criminal behavior is attributed to aggression in childhood, which is socialized in and controlled by the family. A number of children self-reported delinquent acts, including substance abuse and behavioral problems, are powerfully influenced by their attachment to their parents. These familial risk factors include high levels of conflict, that is a history of family violence or abuse, violent discipline or permissive discipline. Permissive discipline refers to reinforcement of antisocial behaviors or drug use by not providing consequences for these poor behavior choices. Poor family management, which includes poor communication and problem-solving skills. Inability to communicate expectations and discipline for maladaptive behaviors. Family cohesion, which refers to attachment and neglectful parenting, low levels of parental supervision or monitoring the child. The parent may be communicating distrust or disinterest in the child altogether. All these factors contribute to the possibility that the child will become involved in deviant behavior and associated with delinquent peer groups. The research stresses the importance of including family when treating behavioral problems. Designed by Dr. James F. Alexander in the late 1970s, functional family therapy is an evidence-based prevention and intervention program that consists of 8 to 12 one-hour sessions that focus on client-based prevention and intervention within their environment and eliminates the need for out-of-home placement, particularly residential facilities. It targets youth between the ages of 11 and 18 at risk of or presenting with delinquency, violent or aggressive behavior, substance use and abuse, conduct disorder, oppositional defiant disorder, or disruptive behavior disorder. Therapists work with families to assess family behaviors that maintain delinquency and modify dysfunctional family communication. From this, the family members learn to negotiate effectively and set clear rules about privileges and responsibilities. While this program originally began with 5 phases, it has in the past few years been narrowed down to 3 separate intervention phases. Phase 1, motivation and engagement in motivation. Phase 2, behavior change. Phase 3, generalization. Do note that assessment continues throughout each phase. The engagement and motivation phase focus on establishing intervention credibility, ensuring clients that this method will work, and addressing maladaptive perceptions, beliefs, and emotions. This requires building trust with the family and attempting to reduce the negativity amongst the members. The goal here is to get an idea of family life in order to understand what behaviors need to be addressed and what each member feels is causing the problems. Therapists must be able to empathize with the feelings of the family, but also help them see a different meaning behind the frustrating behaviors.
Okay, today we have Patrice and Brianna. Patrice is the mother of 14-year-old Brianna. Patrice, you want to tell me why we're here today?
I'm sick and tired of my daughter Brianna. All she does is fight. She's disrespectful. And I can't take it anymore. I just want to punch her in her face because she's just disrespectful. She doesn't do her schoolwork. She doesn't even go to school. And she does drugs. And I can't take it anymore. I just don't know what to do. So I'm stupid. Like, just don't know what to do. And she always calls me stupid.
Brianna?
She's just so disrespectful. The most disrespectful child I've ever seen in my life.
Brianna, you want to tell me why you think we're here?
Well, I really don't know why we're here. I don't think I have a problem. I think my mom is just being dramatic.
Okay.
And I don't like her.
So what do you think is causing you to get into these fights after school?
Because people try me, and I'm not just going to let anybody run over me. So.
And Mom, how do you discipline her when she acts out in school?
I try to take her clothes and her shoes and beat her behind till she can't sit down anymore. But it doesn't work. She doesn't listen. She walks away. She leaves home and doesn't come back until she feels like it, and no one can get in contact with her. It's just crazy. No one knows what to do with her.
Brianna, is there a reason why you leave home when your mom is disciplining you?
Because she's annoying, and, I like to go out with my friends when they're doing stuff, so, I don't like to be home because there's nothing to do, and all she does is talk about how I'm such a bad child, and I don't have time. So.
Give me an example of an argument that you would have during the week.
When I ask Brianna to do the dishes, she always says no.
Well, reason being is because I feel like I shouldn't have to wash dishes after somebody that eats out of them. And
well, Brianna, you live here too, and you create dishes, so
I
you
don't
should
care if I live here. You eat out of
but
the
I'm your
dishes
mother, and I
also.
tell you what to do. So if
Well,
I tell
I
you
don't
what to
care.
do, well, you're one dirty child. You don't think about no one.
Dirty?
She said
I'm
yes, dirty.
See, this is what I mean.
You don't
She's
clean
always
your
calling
room.
me
You don't do
names,
anything.
and it's not right for a mother to call her
It's
child
not right,
names.
but it's.
I just feel like, I shouldn't be the one washing the dishes. And she's always calling me names and stuff. And
You don't do anything
it's
else
very
around the house. Why
disrespectful
don't
to
you
me.
like to wash the dishes?
Yes, I do.
What do you do?
I listen to you all.
No, you don't.
Yes, I do.
You walk away. You leave the house.
Yes.
You don't come back. You don't do anything. Just like now, walking away.
That's okay, let her leave.
Never gonna solve a problem walking away.
So, Patrice, tell me how your parents would have disciplined you if you had acted out the way that Brianna has.
Well, when I was a child, there were no ifs, ands, or buts about what I had to do. And if I didn't do what I had to do, I would just get a beating. But on the other hand, Brianna, she just doesn't listen, and it doesn't work. Like, I try everything, and it just makes her behavior worse. She doesn't listen, and it's just getting out of hand.
Okay, well, it's evident that there is a history of poor problem-solving skills within your family. You learned as a child that violence was the best way to deal with problems, and you are passing that message along to Brianna because now she feels the best way to deal with her problems at school is also through violence.
The therapist's role in this first phase is to explain how these defensive patterns, lack of support of good behaviors, Use of insults and physical discipline evolved as a result of Patrice's parents' teaching. Brianna's behavior was then relabeled as maladaptive problem-solving skills. When she's being harassed at school, she fights, or when she is frustrated or stressed, she does drugs. Brianna's behavior can also be seen as a way of seeking approval and attention from her friends that she is not receiving from her mother. The majority of the family's conflict is attributed to poor communication skills. Patrice insulted Brianna, provoking her until she became angry and eventually left the therapy session. The mother did state that as Brianna's behavior began to worsen in school, her punishments became increasingly violent. Now that we see the abuse has been identified, we shift focus to finding new ways to handle Brianna's behavior. In phase 2, which focuses on education and behavior change, this is where clinicians provide concrete behavioral intervention to guide and model specific behavior changes in parenting, communication, and conflict management. This phase aims to teach the family new skills they are lacking or encourage them to use skills they have more frequently. Basically, a parent training phase that consists of teaching communication and problem-solving skills and providing new parenting techniques to assist in reinforcing functional behavior. In the following clip, we will introduce the use of a contingency plan. Contingency contracting is a way to reinforce functional behaviors. It is created by the parent and the child. Using this, the parent will identify a list of goals that need to be met in order for the youth to be rewarded, and the child is to come up with a list of rewards they would like to receive. Each reward must meet 4 criteria. It does not contribute to irresponsible behavior. It is non-essential. The parent is willing and able to withhold a privilege if it is not earned, and it is reasonable given the context in which the youth and parent live.
So at the conclusion of our last session, I asked Patrice and Brianna to come up with a contingency plan, which is basically a reward program for good behaviors. What were you guys able to come up with?
Well, we decided that if she doesn't get in trouble for 2 weeks, then I will let her go out with her friends or do whatever she would like to do. And I have her sign this contract stating that I will let her go out or do whatever she will like if she stays out of trouble.
Brianna, did you have a specific set of rewards that you picked out?
Well, I would like to go to the movies with my friends on the weekends, and I wanted this particular album from my favorite singer, so yeah.
Okay, Mom, are there any other things that you would like for her to do in order to earn these rewards?
Nothing other than just in contributing into some things in the house, as in doing her chores, as washing dishes, taking out the trash, walking the dog.
Brianna, do you agree to do these things? Well, in order to earn the rewards on the contract that you did sign, you have to.
Okay, well, I think it will take me a while, but yeah.
Okay.
During the next phase, generalization, There is a decline in frequency of sessions. The therapist sees the family every 2 to 3 weeks for the final 2 to 3 sessions and supports the maintenance of change and explains to the family that though they may experience setbacks, they need to continue using the new techniques. The key is for the family to remember to use the new skills to handle their problems and not regress into previously used and ineffective methods. The family is coming in for one last session to see if the contingency chart and new parenting skills have made an effect on Brianna's behavior.
So here we are. It is the final session for Patrice and her daughter Brianna. You guys want to tell me how everything's been going?
Well, a couple of days ago, me and Brianna did have an altercation, and she left home. But otherwise in school, I haven't got a call. I didn't have to take off my job, and her probation officer said she was doing pretty good, and the drug test actually came back good. So other than that, we've been progressing over the few weeks.
How's the contingency plan working? Has she earned any rewards?
Yes, she has. She's been good in school, so I did let her go out with her friends.
That's good. Brianna, have you been doing any positive things at your school lately?
Well, I actually tried joining the book club, and I actually really enjoyed the book. I thought it was going to be boring, but I like it, so I think I'm doing better.
Are you still hanging out with those friends that you used to fight with after school and do drugs with after school?
Yes, but I'm starting to slowly drift away from them because after me and my mom had a talk, I started to realize that they're bad influences.
That's good. That's wonderful. It's good to see that you guys are doing much better.
This program has proven to be highly effective when compared to other approaches, as has proven to be a better source for lowering incidences of juvenile delinquency. In a study conducted by the Florida Department of Juvenile Justice, or the DJJ, that compares the effectiveness of functional family therapy and multisystemic family therapy, it was concluded that the completion rate for youth referred to FFT was slightly higher than those referred for MST. The completion rate for FFT was 76.5% as compared to 71.9% for MST. Results also indicated a lower recidivism rate amongst the youth using the FFT model, 30.1% when compared to MST's 40.5%. In comparison to traditional methods offered by the state, there is also a difference in effectiveness and cost. For families using the FFT model, cost is around $3,557 per family when compared to in the $6,416 for MST. In comparison to other methods used for rehabilitation, such as residential treatment in detention centers, the rate of reoffending is substantially higher with these particular methods. 40% for residential treatment and 52% for detention centers. And the cost for 90 days of a residential treatment facility is $13,000 for the family and $6,000 for a detention center placement for 30 days. These methods have been known to be highly ineffective and tend to not work because they place the individual in an environment with more persons with maladaptive behaviors. I took this information and asked local professionals in the education and criminal justice fields in my community how they felt about such a program being implemented locally. Here is what they have to say. I interviewed Grace Tyson, Director of Youth Activities at St. John Missionary Baptist Church in West Palm Beach, and she stated that with all therapy, success depends on participants' willingness to change. I feel that functional family therapy can be highly effective because one of the greatest barriers to success outside of the willingness to change is transportation to and from therapy sessions. In addition, I think this type of therapy is optimal because participants are in an environment where they are most comfortable. Overall, I would say for inner city and urban communities, functional family therapy is a useful tool. I also spoke with the director or coordinator of the FFT program for Vision Quest. Vision Quest happens to be one of the largest providers of functional family therapy in the country. When I spoke with Richard Berry, he said that I've seen grateful success with this program in our facilities. He informed me that they happen to be one of the largest providers of functional family therapy in the country. He's been using this model for about 12 years. A poll recently conducted showed that they have had an 85% rate of completion amongst families who were enrolled. So he says that the approach is wildly successful. I believe that this intervention is best used anywhere there is an incidence of juvenile delinquency. As we have learned throughout this course, behaviors are learned either through modeling or in response to other behaviors. The thing that I like about this particular model is that it takes a systems approach in correcting the behavior of not just the child, but the entire family unit. The adolescent behavior is broken down to understand why they are misbehaving. Then focus shifts to the parents' behaviors that may be contributing to the teen acting out. This approach is not only prevents these adolescents from becoming involved with the justice system as adults, but it improves the relationship and communication between family members with the hope that these children will become adults that will use more effective parenting skills and break the cycle of abuse. I would like to take a moment to thank my two actresses, Kyla and Tiffany, Grace Tyson for her input, and also Richard Berry for his statement regarding functional family therapy. Hopefully you have found my presentation informative, and if you have any questions, please feel free to leave them in the comment section. Thank you.